Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Chika Oriuwa. She is a psychiatry resident, and we're going to talk about her book. It's titled Unlike the Rest, A Doctor's Story. There's an excerpt from that book on Kevin MD titled How a Psychiatrist Rebuilt Trust with a Patient in Crisis. Chika, welcome to the show.
Thank you so much for having me. It's an honor to be here.
So let's start by briefly sharing your story and journey.
Absolutely. So, I am currently a psychiatry resident on my maternity leave and soon to be returning back to my residency. But a little bit about my backstory. So, I attended medical school at the University of Toronto and I'm currently also doing my residency there. I kind of rose to public consciousness, I guess you can say, when I was doing a lot of advocacy work in my medical school. I was the only Black medical student in my class of 259 starting in 2016 at U of T. And I really became quite a vocal advocate for improving and enhancing equity in medical admissions and medical education. And that kind of spun into this entire realm of advocacy and public speaking for me, where I now have the opportunity to venture into different industries and sectors and talk not only about leadership, but also about the importance of authenticity and really how to bring the best out of every team and organization that we have the opportunity to lead.
All right. So 2016 was 9 years ago. And
Yeah.
has the needle been moved when it comes to diversity and equity in the medical education setting?
I would say that overarchingly, I would say yes, but I also think it's very case specific. And also with the little caveat that we've come so far, but there is still so much more to do. And I can speak to specifically the environment at the University of Toronto, where what it looks like now versus what it looked like 9 years ago when I started medical school is vastly different. They have made incredible, remarkable strides to improve the equity within the admission system, but also within the actual medical education. When I started medical school, there weren't a lot of opportunities to have discourse around the diversity amongst healthcare professionals and how that can really create a different filter or a different lens as to how we engage with medical education. Where now I know that U of T has a Black health theme lead. They have really built it into the curriculum and into the institution such that there is much more support for students who are from historically marginalized groups. And then, of course, they also have the Black Student Application Program, which has significantly changed the entire culture of the medical environment, but also overarchingly has improved the quality of medical education provided to all medical students.
All right. So let's talk about your book, for which is an excerpt on Kevin MD. That excerpt
Mhm.
is titled How a Psychiatrist Rebuilt Trust with a Patient in Crisis. So for those who didn't get a chance to read that excerpt, tell us about that particular story.
So absolutely. So this story is a fictionalized story because, of course, I can't, because of patient confidentiality, I can't use the exact situation that occurred. But in this fictionalized rendition of what happened, there is a patient who comes into the psychiatry department, and this patient is of Nigerian ancestry. They're also present with their younger son, and it is a Nigerian male who comes in exhibiting symptoms of psychosis. This individual and their son are both quite concerned about the quality of the care and the treatment that this patient is going to receive. And of course, being a psychiatry resident in this circumstance, we are taught how to deal with patients who are exhibiting psychosis and agitation. But I think that there's this particular overlay when it comes to the racial dynamics at play, where we understand that certain individuals, such as Black men, are more likely to receive, say, for example, sedating medications within the psych emerge because of some racial biases that might be at play. And so they are also more likely to be involuntarily held within psychiatric institutions, experiencing differential treatment. And so this really played into the dynamic with this patient and their son, who was there partially as not necessarily as their caregiver, but was certainly there to provide support to the patient. And so being able to be cognizant of the ways in which a patient's fears and their concerns can subconsciously affect how it is that they are presenting was something that was really important for me to flesh out in this, because the patient and their son, particularly their son, was trying to drive home the point that although my father is appearing to be quite, psychotic, unwell, agitated, and might appear to be a more of a danger than he actually is, I want to ensure that they are receiving the same kind of care that you would give to everyone else. And so that is where I was really able to pick up on the racial nuances at play. And of course, being a Black physician myself, being able to decode some of that language and ensure that the patient and that the patient's son felt adequately supported with their needs within that particular environment, and really ensure that trust was baked into that patient encounter.
So you mentioned being cognizant of these biases is definitely key to addressing this. So
Yes.
sometimes during the encounter, and I'm sure in the psych emergency department, a lot is going on. There's a lot of pressure, a lot of stress. Talk
Mhm.
specifically about how can we be more cognizant? What are some specific questions one must ask themselves in order to be cognizant of these biases and at least be aware of them? So
Right.
what would that look like?
Absolutely. So I think that when it comes to the work that physicians and healthcare workers need to do, a lot of that occurs outside of the hospital. A lot of that occurs with actually being able to build our empathetic muscles, our compassionate ability to be able to mentalize what it is that a patient might be going through. Specifically within psychiatry, we have this formulation, right? That's how we approach a lot of these patient encounters. And when we're formulating a patient, we have to ensure that we're integrating that psychological and social component, but that we're also looking at it through the lens of racialization. How is it that this person's race and their experiences with race might be affecting their mental and physical health? And a lot of that comes down to being able to educate ourselves outside of the clinical environment, particularly because when we are inside of the clinical environment, and as you mentioned, psychiatry and psychiatric intervent or encounters can be quite stressful. It can be that when you're in that stressful environment, you might not access what it is that you intellectually might know, and you might default to a subconscious bias. It is important that you are doing the work outside of the clinical encounter, so that when you are within the clinical encounter, you are able to then draw upon your knowledge and understanding of how it is that a racial experience or a racial nuance might be at play within the clinical encounter. And that's far easier to do if someone has really spent that time to educate themselves outside of that clinical encounter.
So let's go back to that hypothetical scenario that you mentioned in the story. So, in an ideal circumstance where the clinicians have undergone that training, tell me
Mhm.
what that encounter would look like to prevent something like a biased encounter or an unnecessary sedation and things
Mhm.
like that. So, tell me what an ideal
Yeah.
encounter would look like.
So, say, for example, I think that in that moment, it would behoove the physician to also check in with themselves. Because if you recognize that maybe your heart is racing or you're feeling as though there is more of a threat than there might actually be, you would check in with yourself and ask, okay, is what is at play here? What subconscious biases might be at play here? But then also recognizing and extending that same compassion back to the patient, and realizing that they might feel scared, that they might feel threatened, and labeling that, actually being able to give language to what is transpiring there, and letting the patient know, I can see that, or I'm perceiving that you're feeling a bit more scared. Can
Mhm.
you let me know what is leading you to feel a bit more scared, or do you not feel safe in this environment? How can I ensure that you do feel safer in this environment? So it's really taking that opportunity to put language to what might be unsaid within that space, but that can be directly affecting patient care. And once you do that, you are much more able, much more capable of being able to de-escalate these kinds of encounters without adding unnecessary interventions. And maybe it is such the case where that person might benefit by taking a little bit of Ativan, or maybe they would benefit by having an admission. But at least now you know that you've crossed out some of the things that might be affecting your clinical decision making that are subconscious to you.
Now you're in the midst of training. Is
Mhm.
that type of education happening where you are?
Absolutely. I think that at the University of Toronto Department of Psychiatry, I definitely have received this kind of training, especially in my first year, the first month of residency. There was a lot of emphasis about talking about these kinds of things within my program. And so I absolutely believe that I've received adequate education on this. And of course, there's always ways to improve it and enhance it. And I don't want to depreciate from that, but I do think that the University of Toronto is doing an exemplary job thus far.
Now, this excerpt is from your book. It's titled Unlike the Rest, A Doctor's Story. Tell us more about the book and the events that led you to write it in the first place.
Absolutely. So, this book, I often say, is a story of one. It's my particular story, but it is a tale for all. One that I think that everyone would be able to identify with certain elements of the story. And by the time they close the book, they may feel that they have seen themselves reflected in some way. And so it does discuss my experiences being a Black medical student, being the only Black medical student at the University of Toronto in 20 from 2016 to 2020. But it really explores many different themes. It talks about the formation of a physician and what it takes for us to actually go through medical school. There's interstitials that really dive into the anecdotal experience of patient encounters that really have to do with my own formation as a physician. And so I think it gives a lot of insight into the development of becoming a doctor that a lot of books or memoirs might not necessarily dive into, because a lot of these memoirs talk about what it's like to be a doctor and necessarily about the path to getting there. And it also ties into my own personal experience. So, my cultural experiences being a second generation Nigerian Canadian woman. And it talks about my experiences as well with mental health and my experience with disordered eating and how that affected the lead up to medical school and the preliminary years of medical school, or the initial years of medical school. So there's a lot of different topics and themes sprinkled throughout the book, such that I believe that any reader would be able to pick it up and see a bit of themselves reflected in the story.
So, talk briefly about some of the challenges and obstacles that you faced as the only Black medical student at the University of Toronto, how you overcame those challenges, and how it, of course, influences you now as a physician.
Absolutely. So I would say that throughout medical school, I encountered a variation of micro and macro aggressions throughout the course of my medical education. And that came from patients, sometimes from attendings, from peers, from individuals in the public who heard my story, because I did a lot of public facing advocacy, and they felt the need to extend some vitriol back to me in the form of racism for the work that I was doing. And I remember on my very first day of medical school being asked by one of my peers in medical school whether or not they had made it easier for me to get into med school because I was the only Black student, whether I required a lower GPA. And so, really having to confront this imposter syndrome that was compounded by being a Black woman in medicine, and explicitly having my capacity and my intelligence questioned, and my merit of earning that spot of being in medicine questioned. And so that really evolved throughout the years in terms of the different kinds of racial traumas and slights that I experienced. Some were, more of the microaggression fashion, as I mentioned. So patients repeatedly asking me if I was Canadian, if I was born here, if I trained here, whether or not I was used to the Canadian winters, these kinds of things, or more explicit racism, like individuals online who said that I don't deserve to be a doctor, that they would never let me treat them or treat their children, that I should be kept away from every hospital because, Black doctors aren't smart, or they had thought I had different ulterior motives for trying to champion equity within medical admissions. And so there has been a really this tapestry, I guess you could say, of racial insults and harms has been something that I've certainly had to grapple with throughout medical school, but I consider myself incredibly fortunate such that I have created this community of support around myself that includes family, friends, mentors, lots of therapy, which I think is a central component to be able to mitigate some of that trauma, and recognizing that I can't do it alone, nor should I, and really doing that work within myself such that I can emerge back into my role as a doctor and feel confident and self-assured and also resilient against some of the forces that are trying to keep me and bar me from this career, which I've had this dream of pursuing this career since I was 3 years old. So it is a life calling.
So, at the beginning of medical school, there literally were some of your classmates
Mhm.
questioning why you were there and questioning your merit as to why you were there. What exactly would that conversation look like?
Right. So I actually detail this conversation in the book as well, where I say that I was standing in line waiting to get my med school backpack, and this person came up to me and they said, we're having some, pleasantries and whatnot, and then asking, did they just very bluntly and kind of out of nowhere, well, did they make it easier for you to get in here?
Wow.
Did they have to lower the criteria in any way? Because I'm noticing that you are the only Black student. Was there a separate stream? Was it easier for you? And that for me, I immediately remember, this flash of indignation within me and just embarrassment. This was said in front of a group of people. And then having to say back to them, well, no, I had to get the same criteria, same GPA, same MCAT scores, just kind of rattling through my resume of why it was that I was deserving of my spot in medical school. And then for that person, we're just kind of like, okay, and then moved on to the next conversation. However, that planted a seed within me of doubt of my own capacity, also fear around what other people were thinking about me if they thought that I wasn't smart enough. If this person felt so emboldened to ask me, what are other people thinking that they're not vocalizing? And then placing these unrealistic standards of perfection upon myself, such that if anyone were to question whether or not I was smart enough to be there, I can show them my transcripts in medical school. I can show them my grades just to say I am deserving of doing that. And I talk about the mental health fallout that came from placing that kind of standard upon myself and just how unfair it was for me to be in that position. But it was definitely a really poignant microcosm of what was to come for me in the ensuing 4+ years.
Now, do you have any piece of advice for people who were in your shoes back in 2016, Black medical students today, if
Mhm.
they're undergoing the same microaggressions? What kind of advice do you have for them?
I would say to them, first and foremost, is to recognize the power of your voice and to use the power of your voice, even if it's a whisper, even if it shakes. But it's also incredibly important to have this unshakable understanding of exactly who you are. And there are different ways to which you can arrive to that understanding. For myself, it was certainly through the mode of therapy. And of course, being in psychiatry, I have a bias for therapy. I think everyone can use it, but especially being able to have the internal understanding such that you are the author of your life story, such that you define yourself before anyone else can define who you are, and that you hold firm in that so that you can boldly and unapologetically occupy powerful spaces. And medicine is a powerful space.
Mhm.
And every time you show up authentically, boldly, proudly as who you are in the skin that you're born in and fully aware of your capabilities, not only will it liberate you in so many ways, but it'll also enhance you. You'll become a better doctor for it. You'll become a more compassionate doctor for it. And it will preserve and protect the sanctity of your mental and physical health. So that's the advice that I would absolutely give to Black medical students.
We're talking to Chika Oriuwa. She's a psychiatry resident. Her Kevin MD article is How a Psychiatrist Rebuilt Trust with a Patient in Crisis. And that's an excerpt from her book, Unlike the Rest, A Doctor's Story. Chika, let's end with some take home messages they want to leave with the Kevin MD audience.
Absolutely. The first message is to unapologetically occupy powerful spaces. The second message is to lead with authenticity and compassion. And the third key message is to educate yourself to build that empathetic muscle such that you can be a more compassionate and astute healthcare provider.
Chika, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Thank you so much for having me.